Alright team, let's get into it. Today we're talking about a topic that's fundamental to understanding human health, the immune system, and what happens when it doesn't quite work as it should. Think of your immune system as the body's dedicated security force. It's a complex network of cells, tissues, and organs all working together tirelessly, 24/7, to protect you from invaders like bacteria, viruses, fungi, and other nasty pathogens. It's an incredible system, but like any defense force, it can have weaknesses. When this system is compromised or weakened, making you more vulnerable to infections and diseases, we call this an immune deficiency. It's a broad term, but it essentially means your body's ability to fight off threats is impaired, leaving the gates open for trouble. So, what exactly are immune deficiency diseases? In simple terms, they are a group of disorders in which part of the immune system is missing or not functioning correctly. This isn't just about catching a cold more often than your mates. It's a more serious state of vulnerability. People with these conditions can get sick from germs that a healthy immune system would normally handle without any issue. These infections might be more frequent, last longer, and be significantly more severe. Understanding these diseases is crucial, not just for us in the medical field but for everyone, because they highlight just how vital a robust immune response is for our day-to-day survival and well-being. Imagine a fortress with guards who are either not showing up for their shifts or are asleep on the job. That's a pretty good analogy for an immune deficiency. The invading armies, the pathogens, can just waltz right in and start causing chaos. Depending on which part of the immune system is affected, for instance B cells that make antibodies or T cells that coordinate the attack, the types of infections a person is susceptible to can vary. This breakdown can be something a person is born with, or it can be something they develop later in life. We're going to break down both of these scenarios in detail so you can get a really solid grasp of the entire picture. It's a serious subject, but it's also a fascinating one that shows the beautiful complexity of human biology. By the end of this, you'll have a much clearer understanding of why some people get sick more easily, and what we as current and future healthcare professionals can do to help manage these conditions. We'll look at the causes, the different types, and some of the most well-known examples, including HIV and AIDS. The goal here is to demystify this topic and give you the foundational knowledge you need. So grab your drink of choice, get comfortable, and let's dive into the world of immune deficiencies. It's going to be an informative ride. When we talk about immune deficiency diseases, we generally split them into two major categories. It's a simple but vital distinction to make right from the start. The first category is congenital immune deficiency, which is also known as primary immune deficiency. The key word here is congenital, which means it's something you're born with. These disorders are typically hereditary, caused by genetic mutations that are passed down through families. Think of it as a factory defect in the blueprint for your immune system. From the moment of birth, some part of that intricate defense network just isn't built to spec, leading to a lifelong vulnerability. On the other side of the coin, we have acquired immune deficiency, also called secondary immune deficiency. As the name suggests, these are conditions you acquire at some point during your life. You aren't born with them. This means your immune system was developing and functioning perfectly fine, but then something happened to damage it. An external factor, like a disease, a specific medical treatment, or even poor nutrition comes along and weakens your defenses. This is the more common type of immune deficiency, and it can happen to anyone at any age, which makes understanding its causes incredibly important for public health. To make this distinction even clearer, let's use another analogy. A primary or congenital deficiency is like being given a car that was manufactured with faulty brakes. The problem is inherent to the car itself. An acquired or secondary deficiency is like having a perfectly good car, but then getting into an accident that damages the brakes. The car was fine to begin with, but an external event caused the problem. This fundamental difference is crucial because it dictates how we approach diagnosis, management, and even potential treatments for these conditions. The root cause is entirely different, even if the outcome, a weakened immune response, is similar. As we move forward, we're going to unpack both of these categories in much more detail. We'll explore the specific genetic defects behind primary deficiencies and the various external factors that can lead to secondary ones. Seeing them side by side like this gives you a great framework for organizing the information in your head. Remember, congenital means from birth due to genetics, and acquired means developed later in life due to an external cause. Keep that simple distinction in mind, and you'll find the rest of this complex topic much easier to navigate. Let's get ready to explore the first type, the congenital ones. Right, let's get into the nitty-gritty of congenital immune deficiencies, or as we often call them, primary immunodeficiency diseases, PIDDs. There are actually more than 450 different types of PIDDs identified so far, which is a staggering number. This isn't one single disease, but a huge family of rare chronic disorders. The common thread that ties them all together is that they are all caused by a defect in the body's immune system that is present from birth. These are genetic conditions, meaning they are caused by mutations or errors in the genes responsible for building and commanding the immune system's various components. So, how do these genetic defects actually cause a problem? Our immune system relies on a whole team of different cells and proteins to function properly. You've got your B cells, which are like the weapons factories producing antibodies. You have your T cells, which act as the commanders and soldiers, directly killing infected cells and coordinating the overall response. Then you have phagocytes, which are the cleanup crew, gobbling up debris and invaders. A genetic mutation might mean that one of these cell types doesn't develop properly, isn't produced in sufficient numbers, or just doesn't do its job correctly. It's a highly specific breakdown in the chain of command. Because these are genetic, they are often inherited. This means they can run in families, passed from one generation to the next. Sometimes a mutation can happen spontaneously, meaning the child is the first in their family to have the disorder, but inheritance is a common pattern. The inheritance can follow different patterns, such as X-linked, meaning the faulty gene is on the X chromosome, affecting boys more often. Autosomal recessive, where you need to inherit a faulty gene from both parents, or autosomal dominant, where only one faulty gene from one parent is needed. This genetic basis is why family history is so important when diagnosing a potential PID. The sheer variety of PIDDs means they can affect the immune system in very different ways. Some disorders might only affect one specific part of the immune response, while others can be more global, impacting multiple components. For example, some PIDDs specifically impair the production of antibodies, leaving a person susceptible to bacterial infections. Others might affect T cells, which is often more severe as it compromises the body's ability to fight off a wider range of pathogens, including viruses and fungi. Understanding that a PIDD is a specific, genetically determined fault is the first step to appreciating their complexity and the challenges they pose. Let's look at some real-world examples to make this clearer. One of the most well-known types of PIDD is severe combined immunodeficiency, or SCID. You might have heard of it as bubble boy disease. This is a group of very rare but life-threatening disorders. In SCID, both the B cell and T cell arms of the adaptive immune system are severely impaired or completely absent. Because T cells are essential for activating almost all immune responses, their absence is catastrophic. A baby born with SCID has virtually no functional immune system, making even a common cold virus a deadly threat. It's the most severe form of primary immunodeficiency. Another important example is common variable immune deficiency, or CVID. Despite its name, it's not actually that common, but it's one of the more frequently diagnosed PIDDs. In CVID, the body doesn't produce enough antibodies, which are the proteins that tag pathogens for destruction. Specifically, patients have low levels of immunoglobulins, another name for antibodies. Unlike SCID, which appears in infancy, CVID symptoms can appear in childhood, adolescence, or even adulthood. People with CVID are prone to recurrent infections, especially of the sinuses, lungs, and digestive system. The underlying genetic causes of CVID are still being researched and are known to be very diverse. We also have conditions that affect other parts of the system, like chronic granulomatous disease, or CGD. This disorder affects phagocytes, which are the cells meant to ingest and kill bacteria and fungi. In people with CGD, their phagocytes can swallow the germs, but they lack the chemical ability to destroy them. As a result, the body forms clusters of immune cells called granulomas to try and wall off the infection it can't clear. This leaves patients highly susceptible to severe bacterial and fungal infections. It's a perfect example of how a very specific cellular defect can have massive consequences for the whole body's defense system. Finally, let's consider X-linked agammaglobulinemia, or XLA. As the name suggests, this is an X-linked condition that primarily affects boys. In XLA, the body is unable to produce mature B cells. Since B cells are the precursors to antibody-producing plasma cells, this means the body has virtually no antibodies. Without these critical proteins, individuals with XLA are extremely vulnerable to bacteria like Streptococcus pneumonia and Haemophilus influenzae. They suffer from repeated severe infections of the ears, lungs, and skin. These examples, SCID, CVID, CGD, and XLA, show the incredible diversity of PIDDs and how they can target different aspects of our immune defenses. So we know that primary immunodeficiency diseases are caused by genetic flaws, but what does that actually mean for the person living with the condition? The most obvious and immediate effect is a heightened susceptibility to infections. But it's not just about getting more infections, it's the nature of these infections that is a key diagnostic clue. They are often what we call opportunistic infections, caused by microbes that wouldn't normally make a healthy person sick. Furthermore, the infections tend to be unusually severe, persistent, and recurrent. For instance, a simple ear infection might not clear up with a standard course of antibiotics and could lead to serious complications. The pattern of infections can also point towards the specific type of immune deficiency. For example, if someone has a defect in their B cells and antibody production, they're going to have a lot of trouble with encapsulated bacteria, the kinds that cause sinus infections, bronchitis, and pneumonia. On the other hand, if the T cells are the problem, as in severe combined immunodeficiency or SCID, the person will be vulnerable to a much broader range of pathogens, including viruses like cytomegalovirus, fungi like Pneumocystis jirovecii, and even live vaccines, which can cause a full-blown infection. This diagnostic process is like detective work, using the type of infection as a clue to the underlying fault. Beyond infections, there are other significant health problems associated with primary immunodeficiency diseases. Chronic inflammation is a big one. When the immune system is dysfunctional, it can struggle to properly turn off an immune response, leading to persistent inflammation that can damage organs over time. This can manifest as inflammatory bowel disease, arthritis, or other autoimmune-like conditions. In fact, people with certain primary immunodeficiency diseases have a higher risk of developing autoimmune disorders, where the confused immune system starts attacking the body's own healthy tissues. It's a paradox. The system designed to protect you becomes a source of self-inflicted damage. Finally, and this is a very serious point, there is an increased risk of certain types of cancer. The immune system doesn't just fight off external invaders, it also performs immune surveillance, identifying and destroying our own cells that have become cancerous. When this surveillance system is weakened, cancerous cells have a better chance of slipping through the net, multiplying and forming tumors. Lymphoma, a type of cancer affecting the lymphatic system, is particularly more common in individuals with some types of primary immunodeficiency diseases. So, the effects are truly systemic, impacting everything from infection control to cancer prevention and inflammatory regulation. Now let's switch gears and talk about the other side of the story: acquired or secondary immune deficiencies. Remember, these are the ones you aren't born with. You start life with a perfectly healthy immune system, but something comes along later and weakens it. This is far more common than primary immunodeficiency. The list of potential causes is long and varied, ranging from certain infections and chronic diseases to medical treatments and lifestyle factors. Basically, anything that can put a major sustained strain on your body or directly attack immune cells can lead to a secondary deficiency. One of the most significant causes of acquired immunodeficiency worldwide is, without a doubt, infection. Certain viruses are notorious for their ability to target and destroy immune cells. The most famous example, which we'll dedicate the next section to, is the human immunodeficiency virus, or HIV, which leads to acquired immune deficiency syndrome, known as AIDS. But other viruses like the measles virus can also cause a temporary but severe immunosuppression, which is why secondary bacterial pneumonia is a common and dangerous complication of measles. This highlights the importance of vaccinations in preventing not just the primary infection, but its debilitating consequences. Medical treatments are another major cause. Think about chemotherapy used to treat cancer. These powerful drugs are designed to kill rapidly dividing cells, which is great for targeting tumors, but they don't discriminate. They also wipe out healthy, rapidly dividing cells, including the precursor cells in the bone marrow that mature into our white blood cells. This leaves cancer patients highly immunocompromised and vulnerable to infection during treatment. Similarly, immunosuppressive drugs, which are deliberately given to organ transplant recipients to prevent their bodies from rejecting the new organ, work by dampening the immune response, creating an acquired immunodeficiency. Finally, a range of other factors can contribute. Severe malnutrition, especially protein deficiency, can cripple the immune system because the body simply doesn't have the building blocks to produce immune cells and antibodies. Certain chronic illnesses like kidney failure or diabetes can also impair immune function over time. Even the natural process of aging, known as immunosenescence, leads to a gradual decline in immune effectiveness, which is why older adults are more susceptible to infections like influenza and pneumonia. The key takeaway is that a healthy immune system requires a healthy body, and many different stressors can knock it off balance. When you hear the term acquired immune deficiency, one condition probably jumps to mind immediately: AIDS. Acquired immune deficiency syndrome is the final and most severe stage of infection with the human immunodeficiency virus, or HIV. It's crucial to understand that HIV and AIDS are not the same thing. HIV is the virus, the pathogen that attacks the immune system. AIDS is the syndrome, the collection of symptoms and illnesses that occurs when the immune system has been so severely damaged by HIV that it can no longer fight off infections and diseases. A person can be living with HIV for many years before they develop AIDS. So, what does HIV actually do? Its primary target is a specific type of T cell called the CD4 plus T helper cell. You can think of these CD4 cells as the generals of the immune army. They are responsible for coordinating the entire immune response. They send signals to B cells to start making antibodies, they activate killer T cells to destroy infected cells, and they call in the phagocytes to clean up. HIV is insidious because it specifically infects and destroys these command and control cells. As the virus replicates, it gradually depletes the body's supply of CD4 cells, effectively dismantling the immune system's leadership structure from the inside out. A person is diagnosed with AIDS when their CD4 cell count drops below a critical level, specifically, below 200 cells per cubic millimeter of blood. A healthy count is typically between 500 and 1,500. Alternatively, a diagnosis of AIDS can be made if a person with HIV develops one or more specific opportunistic infections, regardless of their CD4 count. These are infections caused by pathogens that don't usually cause illness in people with a healthy immune system. Examples include pneumocystis pneumonia, a fungal lung infection, Kaposi's sarcoma, a type of cancer, and cytomegalovirus, known as CMV, infection. Without the CD4 generals to lead the fight, the body becomes defenseless. The development of AIDS marks the point where the immune system is so weak that the person is at high risk for these life-threatening opportunistic illnesses. Before the advent of effective treatment, an AIDS diagnosis was a grim prognosis. However, it's vital to stress that modern medicine has transformed this. With today's antiretroviral therapy, we can suppress the HIV virus, prevent the destruction of CD4 cells, and stop the progression to AIDS. A person living with HIV who is on effective treatment can maintain a healthy immune system and live a long, normal life. To effectively combat a disease, we have to understand exactly how it spreads. HIV is not transmitted through casual contact. You can't get it from hugging, sharing food, or from a toilet seat. The virus is found in specific bodily fluids: blood, semen, pre-seminal fluid, rectal fluids, vaginal fluids, and breast milk. For transmission to occur, one of these fluids from an HIV-positive person must get into the bloodstream of an HIV-negative person. This can happen through a mucous membrane, found in the rectum, vagina, mouth, or tip of the penis, through open cuts or sores, or by direct injection. The most common modes of transmission worldwide are unprotected sexual contact, anal or vaginal, with an infected person, and the sharing of contaminated needles, syringes, or other drug injection equipment. Anal sex is considered the highest risk sexual activity for transmission because the lining of the rectum is thin and can tear easily, providing a direct route for the virus to enter the bloodstream. The virus can also be passed from a mother to her child during pregnancy, childbirth, or breastfeeding, which is known as perinatal transmission. Thankfully, with proper medical care, the risk of perinatal transmission can be reduced to less than 1%. Once HIV enters the body, it begins its attack on the CD4 cells. The progression of the disease generally follows 3 stages if left untreated. The first is the acute HIV infection, which occurs 2 to 4 weeks after exposure. People may experience flu-like symptoms like fever, rash, and fatigue as the body mounts its initial, but ultimately unsuccessful fight. During this stage, the viral load is extremely high and people are very contagious. After this, the disease moves into the chronic HIV infection stage, also called clinical latency. Here, the virus is still active but reproduces at very low levels. People may not have any symptoms, but they can still transmit the virus. Without treatment, this chronic stage can last for a decade or more, but it will eventually progress to the final stage AIDS. As we discussed, this is when the immune system is critically damaged. The time it takes to progress from HIV infection to AIDS can vary greatly from person to person depending on genetics, their health before infection, and other factors. However, the crucial point is that medical intervention can halt this progression. Antiretroviral therapy, or ART, is the key. By taking a combination of HIV medicines every day, people with HIV can keep their viral load very low, so low that it's undetectable, which protects their immune system and prevents transmission to others. Prevention is, without a doubt, the most powerful tool we have in the fight against HIV and AIDS. Knowledge is power, and understanding how to protect yourself and others is paramount. The most effective way to prevent sexual transmission is to use condoms correctly every single time you have sex. For individuals who inject drugs, it is absolutely critical to never share needles or other equipment. Many communities have needle exchange programs that provide sterile needles to help reduce this mode of transmission, which is a vital public health initiative that saves lives. In recent years, our prevention toolkit has expanded significantly, which is fantastic news. We now have pre-exposure prophylaxis, or PrEP, a daily pill that can be taken by HIV-negative individuals who are at high risk of infection. When taken consistently, PrEP is highly effective at preventing HIV acquisition from sex. There's also post-exposure prophylaxis, or PEP, which involves taking antiretroviral medicines after a potential exposure to HIV to prevent becoming infected. PEP must be started within 72 hours of the exposure to be effective. These biomedical interventions have been game changers in HIV prevention. Another cornerstone of prevention is the concept of undetectable equals untransmittable, or U equals U. This is a simple but revolutionary message backed by overwhelming scientific evidence. It means that a person with HIV who is on effective antiretroviral therapy and maintains an undetectable viral load cannot sexually transmit the virus to their partners. This not only empowers people living with HIV and fights stigma, but also serves as a powerful incentive for people to get tested, get into care, and stay on their treatment. It transforms treatment into a form of prevention. Regular HIV testing is also crucial so that people know their status and can take the appropriate steps. Wrapping this up, understanding immune deficiency diseases, from the rare genetic forms like SCID to the globally significant acquired form like AIDS, is essential for any student in the healthcare field. These conditions underscore the elegance and importance of a functional immune system. The progress we've made, especially in managing HIV, is a testament to medical research and public health efforts. But the work isn't done. Keep learning, stay curious, and be an advocate for evidence-based medicine and compassionate care. If you want to keep diving deep into medical topics like this, make sure you subscribe to Joen Academy for more content. Stay sharp, and I'll see you in the next one.